The time now is 4:03. I call to order the Health and Mental Health meeting of the Orange County Legislature. Please note this meeting is being transmitted live via video stream. The public can find a link to the video stream by visiting the Orange County website, www.orangecounty.gov.com, clicking on the tab for the legislature and locating the meeting on the calendar. I ask you to please silence your cell phones, tablets, and other electronic devices, and be mindful that the microphone here in the statutory committee room is very sensitive and robust. At this time, if you would please rise and join for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
During, you do the roll call, please.
Eno. Here. Anagnestakis. Ellers.
Here.
Fagion.
Here.
Luhan.
Present.
Sutherland. Here. Hotel. Here. Chewy.
Here.
7 present, 1 absent.
Thank you. First up, we have today Darcy Miller, Commissioner of Social Services and Mental Health. Hello again.
Hey there.
First up, we have a request to create 1 full-time fee negotiator position and abolish 2 part-time fee negotiator positions currently vacant. The majority of funding for the new position will be covered through fee revenue. Legislative request number 098. Can I get a motion?
So move.
Second, Luhan.
Okay, go ahead.
Thank you for your consideration. So we have, as you know, our clinics operate. We have a clinic in Port Jervis and one over in Newburgh. Last year, they produced 1,400 more services than they did the year prior. And we have asked permission and gained support to actually fill additional positions because the need in our community for mental health services is so great. We like to operate on an immediate access model. So we don't expect people to come in with a mental health need today and not get an appointment for 30 days from now. Right now, we're not able to accommodate that, which is our best standard practice. So we appreciate the ability to hire additional. That means, though, that's an additional up to 200 more clients, which is that many more services a day, 6 services on average. Our clinicians are producing well beyond the 1,240 units of service a year expected. They're producing as many as 13, 14, 1,500 services a year for each clinician. Plus, we're bringing on Monroe Woodbury School District as a satellite. We've already begun with Goshen, and their MOU is already signed. So Goshen will be the next school district that will be brought on as a satellite and on forward. So that's more and more services to be billed, and our billing team is awesome. We have 93% of our revenue that's billed for is being collected currently. So with that, we need these 2 positions, part-time positions, which are vacant. We have a grade 6 that has been assisting that we'd like to provisionally appoint to a full-time position by combining those. So there's no additional cost to our budget.
Now with the current employment situation, do you anticipate problems once, obviously, when you get up and run in Middletown and Goshen and the other services?
Yes.
What are we planning on doing with that?
Well, we're reaching out to colleges to see, if we have any students that, are interested in coming interning with us, who may be possible staff, employees going forward. The thing with our clinic positions, they require a LCSW, which I think we mentioned here, requires them to have an additional certification licensure. So we can use those who are in training in our satellite positions.
Okay.
So we're hoping to be able to, fill those positions with advertising. We're using, HR is helping us out with advertising. We're using other social media sites like Indeed and other sites like that to try to attract people to come to work with us. You're right. It's great to have permission to hire. Now we just need to find people to fill them.
Yeah, and then if you're having a hard time, then you're going to have to hold up the operation and not move forward with, let's say, a Goshen or Monroe Woodbury And so keep us up to date on that. Legislator Sutherland.
Thank you. So with the certification, is that something that the person could be hired with the, if they're showing that they are working toward and they schedule the date, like could it be like a provisional hire until they pass their LCSW exam or?
Currently, our staff social work specs require you to have an LCSW, and the reason why is, first of all, because we're typically able to attract that level of expertise. But because when you're billing, some insurances require you to have that licensure. So we have knocked around the idea of approaching HR to see if we could do a staff social work 1 and a staff social work 2. So we could hire an LMSW in training, and then we'd only assign them certain payers, so we could still bill for them. We're not that desperate yet, but we may become such.
Thank you.
Are there any other questions? Not seeing any, I'll call a question. All in favor, aye?
Aye.
Aye.
Thank you.
No opposed? Unanimous? All right, Commissioner, if you go into your monthly update, please, that would be great.
Sure. I talked a little bit about, we're meeting with the state commissioners regarding cross systems youth. So the complexity of need of some of our young people is so great, and they have multiple diagnoses and they have multiple challenges, and we have funding streams that are very narrow. So we appreciate those conversations, and I'm glad to be a participant at the table to talk about how we might do some cross systems work. And as you know, with having the 2 departments, child welfare and mental hygiene and IDDD, they come interface quite often, especially with high complexity need families and youth. So it's a very positive discussion, and it feels like we might actually make a difference. This conversation's been going on for years, but it feels like the commitment is to come up with a solution. So I appreciate that. Our agencies are hiring, so we expect to see an additional team, mobile response team out on the streets very soon. We have 2 additional peers that will be assisting our crisis response, and they've already hired and planned for an additional person at the call center to assist with our crisis continuum work, and that will make law enforcement, I think, very happy across the county, because they're looking for more active response, co-response.
Well, before we move on that, you said that the people have been hired. Do they have a start date yet, or are we waiting to get the $1 million from the state?
We have the $1 million.
They did come
The
in.
last time we met, I think that we didn't have it in our accounts yet.
Yeah.
But we do have it. So
Okay.
$500,000 is for this year and $500,000 for next year. We've already put the contract change orders in for our 3 agencies that will be receiving
Terrific,
those
so it's
funds.
all
It's
full
all
steam ahead. Good.
Yes, you're correct.
Okay, sorry to interrupt you.
No, that's okay. The Children's Mental Health Awareness Walk, this is Mental Health Awareness Month. So we appreciate all the advocacy of all of our stakeholders across the county who are sending messaging to reduce stigma, improve access, and to support people who are struggling. I was able to participate in the Children's Mental Health Awareness Walk on May 7th, even though I think it was 40 degrees and raining. It was really cold. But it was a great event. It was attended by many families, many stakeholders, and just a nice event to come together and support the needs of our children. Just want to jump, I don't have it in this order, but I'll just jump to the 0 to 5. We talked about, we brought pediatricians together and prescribers and other mental health stakeholders, including our health department, to say, how can we fill the gap with children who have great need? And we came out of that with putting together a mapping exercise. In Georgetown University is actually going to be a technical assistance for us. So it's part of their mission under their SAMHSA funding from the federal government. So we're very excited that that's going to go forward. We're going to schedule it for the fall. The purpose of that is acknowledging that through the pandemic, many children lost developmental skill sets, and we want to help our community be prepared to respond to the needs of our 0 to 5, because the prevention of ongoing issues at that age has long-reaching effects for young people, their success in school, their success in community and families. So we'll have many stakeholders at the table to proceed with that. It's exciting work that we're bringing forward. Just to say, our Healing Community Study, that's the Columbia grant that was NIDA funded. We were in phase 2. We now go active as of July this year, and that will happen right as we are planning for the settlement funds. So the county executive has asked me to put a committee together to plan for the opioid settlement funds. What we've decided to do is use our Healing Communities Steering Committee for both of those initiatives. So if you imagine in July, we're going to have federal funds that are coming into the county through Healing Communities to fill some of the gaps, and that's going to be available until about 2024. At the same time, we have some settlement funds coming into the county that need to be planned for. So by using separate discussion about each of those pots of money, but it will coordinate our response by using the same steering committee members. So I think we have a nice cross-section of stakeholders, and those first meeting will be scheduled for Monday, and looking forward to some of the ideas. We have, listen, there's federal recommendations that have been put out, there's state recommendations that have been put out, and we have our own local, we've been since 2013, had our opioid task force. So with the combined, we pretty much know how we're not reaching people and how we can better reach them and what we need to do once we do. So it should be a good discussion. School salary, we talked about those. Money, talked about that. Workforce, you already know about that, and that covers my report.
All right, great. Are there any questions from committee members? Non-committee members? Legislators? No? Okay. Thank you, Commissioner.
Thank you. Have a good afternoon.
You too. All right, number 2, up next, we have Lawrence Ledoux, Commissioner of Valley View Center, and Donna Strecker, Director of Finance, Valley View Center. Good afternoon. Good afternoon. All right, first up, we have your financials.
All right, the results we're reviewing today are for April, reconciled to the general ledger as of 5/12. There's been no change in the IGT funding since the last publication. We're still at 2.128 million. Emergency disaster funding, we did receive 86,445. There's also an additional 3.2 million pending posting to the general ledger. That's for the provider relief funds. Other revenues, so far year to date, we have 8.8,576,000. We have an additional 2.1 million earmarked also, but has not posted to the general ledger. On the personal service side, we've expensed $6 million. Equipment, 19,911. On the contractual side, we've earmarked $3.4 million for expenditure, and we've already expensed 2,563,000. On the employee benefits side, we've expensed just under 5.9 million, and serial bond interest debt coming in at 39,935.
Any questions on the financials? No?
Yeah, on contractual, can you go back over that one?
I'm sorry,
Contractual line?
Contractual,
on the contractual line, so,
yeah, my printouts, I'm missing
Oh,
what the
okay.
remaining balances.
oh, okay, you're missing year-to-date actual. And the remaining-
2022 remaining balance.
Oh, okay, the remaining balance is 8,913,421.
Okay, great, thank you.
You're welcome.
And no other questions, we'll move on to the update.
We go,
Go to the rest of your update.
if you go to the next page, you'll, that you can see what the historical census is and the number of days billed. Year-to-date performance coming in at 68.88. We're kind of in a holding pattern until we can resolve these staffing issues.
Well, we just keep on dipping. Gonna have to extend your chart down.
Yeah, it's very telltale.
Okay, Lawrence, if you want to do the
Sure.
update.
The census for yesterday was very similar to the census that Donna just reported, just under 69%. We still have 2+ units closed. We are accepting short-term admissions only up to 12 on 1 unit. Our Valley View CHA census is currently 16, which is good. We currently have 4 COVID positive employees and no positive residents. It's funny how, things can change just in a day. We've had 6 additional staff test positive just from me sending this report out yesterday to today. So, but still no positive residents. No units are currently on precautions and visitation is still allowed. We will be hosting a COVID vaccine pod tomorrow with the help of the Orange County Health Department, which is fantastic. And it'll be for our residents and our staff. Any COVID vaccines that are needed, first dose, second dose, first booster, or second booster will be administered. So we're looking forward to that. Valley View is currently undergoing an audit from the Office of the Medicaid Inspector General. They are specifically looking at the capital component of our Medicaid rate from 2016 to 2022. Additionally, Valley View is working with O'Connor Davies to finalize our 2021 audit. I didn't put this in the update, but I should have. We had Nursing Home Week last week. It was the first time we got to celebrate it in 2 years. Thank you for coming.
Sure.
Thank you for bringing the certificates from the legislature. That was fantastic. We celebrated our 25, 30, and we actually have 1 employee that celebrated 40 years working at Valley View. So we celebrated them last week on our opening day kickoff. And we recognize the 14 National Guard members that are currently at Valley View. They will finish at the end of this month. So
So they'll be there for the Veterans Barbecue? Not barbecue, but they're coming this Thursday from the American.
yeah, they should be there. Yeah, good.
Tell them to bring some extras.
Yeah, definitely. That's great. So yeah, they've been fantastic. The New York State budget included a bonus/staffing retention funds for healthcare frontline staff. We are still awaiting the specifics for how we're supposed to pay that out and the guidelines from New York State. And as soon as we get those, we will get those payments out to the staff. And that's all I have.
Any questions?
You want to mention this?
Yeah,
Hold on
there was
a
a
Go ahead.
follow-up item from the last meeting. I believe it was Legislator Anastakis had asked for the revenue for the CHA. So to report on their financials as of April. As of April, they have generated 86,000, almost 87,000 in revenue, and their year-to-date expenses right now are 124,000.
Well, I noticed that keeps moving up. You're slowly able to take a few more on, even with the staffing.
Yeah, I mean, the good news about the CHI is we have been able to, the community knows about it, the hospitals know about it. So, when we started the CHI, we thought the majority of the feed from the CHI would be from Valley View short-term residents. And as you know, our census is low on our short-term resident side. So it is affecting, unfortunately, the CHI a little bit as well. But the hospital and the community does know about it. So we are getting patients for the CHI outside of Valley View, which is helpful.
Great.
Yep.
Legislator Tortel, please.
Thank you, Mr. Chairman. If you go back to the New York State, because it wasn't on the printout, New York State staff retention bonus, how much were we?
I didn't bring the specifics with me. Do you know off the top of your head?
Two tiers, I think.
I'll bring that next time, or I'll email it to you.
Yeah.
Everybody
so this
tomorrow?
This is money that they're sending
It's in the
down.
actual New York State budget. They'll send the money to us and then we'll give it to the employees. And then there's guidelines that, you have to work a minimum number of hours. And we haven't received, and I guess there's,
Is this the first year for this or?
yeah,
So
first year. So I guess there's gonna be vouchers or something we have to fill out, but we haven't received any information yet on it. So,
So if you could just send that to Doreen.
yeah, I'll send it tomorrow.
thank you.
And any other questions? Legislator Amo, I don't know if you want to give a little update on the advisory committee or that you're up and running and.
Our next meeting is scheduled for this coming Wednesday, I believe, the 2 o'clock.
For next week.
Virtually, right? And at this point, what we've done is we have completed a sort of a wish list as a component. Let me just back up and say, for those who don't try to put it in perspective, is the real question being asked is, can Orange County facilitate or help propel the creation of a sort of a long-term care campus that supports Valley View needs, that supports the residents of Orange County, and maybe does something no one else has ever done. When you try to do something nobody else has ever done, it's a big bump. We worked on it. Mr. O'Donnell had, Legislator O'Donnell had it for a couple of years, I believe. And we put together quite a list of things that we thought needed to be included, although it's a work in progress. Some may be added, some may be taken off. And then the question became, we have the consensus of trying to think about, can we get a conceptual plan? Because it's kind of hard for most people to understand what you're talking about a long-term care campus. So can you do it in a way that shows how all the parts are going to connect and try to accomplish the same goal? And I think somebody said the best way would be a conceptual plan, not a master plan. That's a bigger project. Some concept that we could get out. So we're now in conversation with Chairman Benelli about the possibility of having a conversation with leadership and the county exec's office about, is it possible to move forward with this? It may cost some money to get a consultant to do a plan for us. Do we really want to do it? Right? So that's where we're at. We'll finalize that process next week in terms of where we're going, and hopefully be able to make a recommendation to the legislature of what we want to do.
Great. Well, on behalf
And the next step is if the green light comes on, then decide what we have to do next. We really think it should be, so no one thinks it's a big government overreach. Everybody's talking about it as a public-private model. You know, conceptual plan up and invite people to work with us.
Right.
In some way, it would be a good idea. And so it's not the government's going to do everything. We're going to try to make it work so people can be in partner with us.
Terrific. Well, on behalf of this committee, I want to thank you for your leadership on taking us down that road and for the betterment of everybody and also Valley View itself. Thank you. Any other questions or? No? Okay.
Thank
Thank
you.
you very much.
Appreciate it.
See you Thursday.
Yep.
All right, next up, number 3, we have Dr. Irina Gelman, Commissioner of Health. Chris Erickson, Deputy Commissioner of Health Department. Come on down there. Your place? Okay.
If you need me, I'm right here.
All right, well, first up, we have a request to accept grant funds from the New York State Department of Health for the Perinatal and Infant Community Health Collaboratives Program. The amount of $2.2 million for the period of 7/1/2022 through 6/30/2027, and to appropriate first-year funds in the amount of $440,000 for the contract period of 7/1/2022 through 6/30/2023. Legislative request 085. Can I have a motion?
Second, Helen.
Mr. Chairman, please, me.
What, do you want to be added?
Yes, please, the sponsor.
Okay, Commissioner?
Thank you very much, Mr. Chairman. Good afternoon, everyone. So the Perinatal Infant Community Health Collaborative, the Orange County Department of Health responded to an RFA, which was awarded in March of 2022. It is $440,000 per year for 5 years. It will examine the social, ecological, environmental, and community conditions that affect women and infants. This grant will examine substance and alcohol abuse, mental health, safe environments, family planning, domestic violence, and developmental issues while identifying and finding solutions to barriers women in our county face. Focus is in the cities of Newburgh, Middletown, Port Jervis, and the towns of Chester, Goshen, Highland Falls, Highland Mills, Wallkill, New Windsor, Pine Bush, Walden, and Monroe, Palm Tree. The goal of the initiative is development of relationships and systems to coordinate health and supportive service programs that will improve maternal and infant health outcomes and eliminate disparities. The program supports 3.5 stipulated positions, 2 full-time community health workers, 1 19-hour per week community health worker, and 1 vacant program supervisor.
Great. Any questions from the committee? Okay, not seeing any. All in favor, say aye.
Aye.
Any opposed? Motion passed unanimously. All right, 3B, request to accept and appropriate year 5 funds into the operating budget for the Adolescent Tobacco Use Prevention, a Tupa, grant from the New York State Department of Health for the period of 4/1/2022 through 3/31/2023, the amount of $97,198, legislative request number 094. Can I have a motion?
Second.
Hey, Doctor.
Thank you, Mr. Chairman. Now, this is the Adolescent Tobacco Use Prevention Act, or Tupa, and it is year 5 of a 5-year contract with the New York State Department of Health. The primary activity for this program is the enforcement of the New York State Article 13F. This grant will fund 1/2 top community health worker and 1 contracted Tupa compliance worker and 4 compliance workers 18 to 20 years of age who are paid by the hours worked. 392 compliance checks were conducted this grant year, resulting in 28 sales of tobacco or flavored vape products to minors. We met the goal of completing at least 1 compliance check for each facility and 2nd and 3rd inspections for all vendors with points on their records. It's a tremendous program. It definitely ensures that there are no sales to minors and tries to prevent them to the best of our ability. So it's a fantastic program.
Legislator Amos.
Over the last, say, 3 years or 5 years, how's the curve look in terms of number of people are finding or catching? I asked the question in terms of, is it really improving things or is it not?
So it's an interesting question only for one reason. A Tupa Act has now included vape products, and there was some ambiguity early on with vape products first being on the shelves and now being added. So because it includes it, there's a little bit of carryover from that, so it's very difficult to gauge because some of the violations include those products that previously were able to be sold, but now obviously are covered by the program. That's why we have experienced an increase, but part of it is with that vaping
Have you
product.
been able to extract that? Get a sense of, take those
I can look into it and follow up, just for a ballpark. We have seen an increase overall though. And I will say this much, when we are in these Tupa checks now, we're seeing a lot more marijuana being sold very creatively in creative ways, but through the Office of Cannabis Management, even though there's this kind of rampant belief that it's now legalized, the vendor actually has to be permitted by the Office of Cannabis Management prior to being able to sell. So we're catching a lot of that and we're working with law enforcement from the state
so
to. It's not quote unquote included, but we're just coming across that and reporting that to the state as we go along sort of. So that's why we have seen a substantial increase, especially since legalization.
Doctor, with the, this is the 5th year of
Yes.
the program. Have you heard any early discussions where if this, or this could be continued? And then again, as you're giving the information about the cannabis,
Will that be included?
combine it.
So-
And hopefully you get the funding.
Not yet. We're not hearing it. Typically, it is extended. We have not heard of whether or not or when per se, but typically this is extended. It's an ongoing program. It has been for quite a while. Now, a lot of the products as they come out on market, similar to vaping, are included under the Clean Indoor Act, which is slightly separate from this particular program, but also kind of on the auspice of the Department of Health. But as far as cannabis, the Office of Cannabis Management is so new under the state, and it's just been separated out of the New York State Department of Health. They've sort of carved it out. So now they're really coming up with the policies and procedures moving forward. And I know they're just ramping up their campaign, a lot of their prevention campaigns as far as driving, as far as generalized education, because again, the notion is now that it's legal, the broader understanding is that it's legal to sell as well, but it's in fact not until you're actually permitted by the Office of Cannabis Management, not unlike alcohol or any other sales. So I think that education component is going to come across right now as the Office of Cannabis Management is actually establishing itself.
And these funds, the 97,190 and 198, that was the last year, but that was from the old tobacco settlement money? was there a tobacco settlement money years ago? And,
Is this coming from the tobacco settlement? I think this is funds that are separately allocated as far as.
we may have
health
used those
prevention
funds
and
up already.
monitoring.
That's my question was if they used up the settlement, there's no more settlement.
Sure, yes, Mr. Chairman, at one point, there was settlement funds involved with this type of thing. These funds now come from more directly from the State Department of Health.
From the Department of Health. Okay, thank you. Hold on, I have Legislator Tortel and then Legislator Amos.
On the last request, it was a lot different. The employee chargeback category on the budget, it's almost double the actual base salary. And I forget what that line is. Do you know what that one is? Why?
So employee chargebacks, that's other work that other people are doing in the office that aren't associated with the grant itself. So the grants allow us to charge back a certain percentage.
That's not the question.
And
Thank you.
that's why we're allowed to do that.
I was sitting here trying to remember, and I kind of.
So for instance, the fiscal division or any other clerical work or processing work
Right.
that's done, that's charged.
Thank you.
Legislator Amos, the floor is yours.
Yeah, if I was up to, I was asking the trending question. Is there any component of where we try to get ahead of the curve and educate our people? There seems to me, I've only talked to a couple of vendors who got snagged accidentally because they had younger workers, whatever reason, and they ended up losing a lot of revenue. And they made a mistake. I'm not saying they're innocent. But our real goal is to get zero.
Yes.
Everybody does it right.
And that's part and parcel of that because it's housed in the Community Health Outreach Division. The short answer is yes.
We have money.
Between posters and between a lot of just informationals that go out there, the short answer is yes. But unfortunately, you do have that component where the vendor has to become compliant throughout time, and that's kind of the spot check.
That should not be right, though. If we really want to, we should not, we're not trying to hurt our local businesses.
Absolutely
We
not.
really, if they make an honest mistake and they don't know something, I think we should be putting some money, if the state does, maybe the county should be doing some money in there trying to facilitate an education piece, so it is a major hit on something,
Understood.
that's all.
Majority Leader.
Thank you, Chairman. Dr. Gelman, just one quick question. In broad strokes, talking about adolescent tobacco use prevention, is there a trend? Are more younger kids smoking now? Are the numbers going up? Are they going down? And is vape and now this whole concept of what is legal marijuana not, are those two things contributing to an increase?
Yes.
Are you seeing numbers that way?
Unequivocally, yes. And even from the school surveys that we are conducting, the answer is yes. Unfortunately, even some of the school surveys that compare perception of use by parents and the same demographic as far as the children that they perceive not to be using, whether that's vape, cannabis, or smoking, drastically different survey outcomes. So I would love to forward some of that data. Some of it is in Fort Jervis, some of it, all across the county. We do have segments of that data on usage based on school surveys. The way students are answering the questions, again, anonymously without any repercussions to them, drastically different from the parental perception of what the adolescent use is. And unequivocally, yes, there is an increase, especially in vape products and vaping with THC, CBD, and other, unfortunately, yes.
And if I could follow up real quick, and I hate to say the phrase, it's safe to assume, but I know me being an older, not being a kid anymore, the old people our age, grown-up people, their perception of what this vape is, what it is not, like you said, the THC component, are you seeing that are you seeing that adults aren't properly informed or information maybe isn't out there or they're not learning enough about what vape really is and some of the real serious dangers?
Absolutely, and also the way the cartridges are actually manufactured, they could be misconstrued as USBs, they could be misconstrued as something other than vaping or cannabis use products. So unfortunately, again, being of older age myself, some of the products that are out there right now may really be masked as something other than. So even an individual that's older going through a room may not necessarily recognize it. However, the prevention councils, they do have wonderful trainings for parents that can be taken advantage of on actually recognizing a lot of these products, because some of the products with even names like Captain Crunch or some of the things that may not necessarily be associated with a vaping product by a parent is exactly that, unfortunately. And that's not even considering the additives in a lot of the things that are.
Thank you,
If
Doctor.
I may.
Thank you.
So ADAC does, I'm sorry to take away from your thing, but ADAC, just for everybody's knowledge, does a thing where they will set up a child's bedroom and give the parent the opportunity to go in and find the ways to hide it, the ways to conceal it. And there are USBs. And you can look at a kid in school and they can have that sucker plugged in, and guess what? It's a vape thing, it's not a USB. And they teach the parents different ways to recognize these signs. ADAC. So
The unfortunate is, yes.
I just don't get how bad it is for the kids.
Thank you, Chair.
All right, if I may call the question, any other questions, or we'll call to question this portion. All in favor, say aye.
Aye.
Any opposed? Passed and unanimously. 3D, request to accept grant funds from New York State Department of Health AIDS Institute.
We're on C.
Who?
C. We're on
C.
C.
3C, yeah, sorry. Pitch. Sorry, gang. 3C, request to and accept appropriate year 5 funds in the operating budget for the period of 4/1/2022 through 3/31/2023 from the New York State Department of Health Immunization Action Program, the amount of $189,605, legislative request number 090.
So moved, Tortel.
Second, Luhan.
Yes, Commissioner.
Thank you very much, Mr. Chairman. So the Immunization Action Program grant funded by the New York State Department of Health, this is year 5 of 5 years. The most recent data analysis from the New York State Department of Health Bureau of Immunization revealed that only 37.39% of 2-year-olds in Orange County are appropriately vaccinated as of the end of 2021. Now, again, these are just regular scheduled vaccination against vaccine preventable diseases. This does not include COVID-19 or anything of the sort. We are discussing 2-year-olds for this particular segment. This is significantly lower than the New York State outside of New York City numbers, where 67.71% of all 2-year-old residents are appropriately vaccinated. This is a considerable decrease from 2020, even for Orange County. The purpose of the grant is to help increase immunization coverage among county children aged 19 to 35 months by conducting daycare record reviews and school trainings, technical visits. This grant provides funding for professional public health nurses and clerical staff, secretarial staff to support ongoing immunization initiatives, provide perinatal hepatitis B case management for every newborn to a woman with hepatitis B positive or unknown status to assure post-exposure prophylaxis consistent with CDC guidelines, increase adult immunization coverage rates by conducting adult provider visits and participating in an adult immunization coalition using an evidence-based coalition intervention. As a matter of fact, I'm actually coming to this meeting after convening the Hudson Valley Immunization Coalition. Some of our areas with even lower vaccination rates that are more densely populated. We are working with schools and medical providers in the area to ensure that we're increasing vaccinations there. So we've just convened that council meeting at 2:00 today. So we're hoping to continue that discussion to ensure that we're increasing.
And what was Orange County at compared to the state?
So Orange County
I think it was
currently
37%.
37%, 37.39 versus the rest of New York State outside of New York City,
Yeah.
67, is it 67%?
6-7 or 5-7?
6-7. That's
So
the
you're
rest of New
looking
York
at
State.
at ways to help promote this.
Increase that
Is
percentage.
there any reason that you?
So unfortunately,
Correct, yeah.
post-pandemic, I have to bring up the post-pandemic factor. There
Does
is a
it stop?
tremendous, well, it's two-pronged. There's both an aversion to vaccination and a lot of the misinformation that has resulted from the pandemic itself and from vaccination efforts during the pandemic, which are quite separate from regular scheduled vaccinations that we've had around for decades now. They're sort of being packaged together. The good news is in reviewing a lot of the records for all of our schools, we're able to catch that because New York State law, a few years back, under former Governor Cuomo, there was a law that was signed eliminating religious exemptions for vaccination. So that's helping us substantially to ensure that individuals are not presenting into a congregate setting such as a school for outbreaks to occur. Clearly, this poses an issue. As a matter of fact, that's on our updates. It's one of our public health alerts that we've issued because with what we were discussing last session with the global situation with a lot of outbreaks of formerly vaccine preventable diseases such as measles, poliomyelitis, other diseases, we are seeing a resurgence globally with individuals potentially visiting or staying in the area that may have active infection. When you're coupling that with a population that's at an extremely low rate of vaccination, that's sort of a collision course for a concurrent outbreak. So we're definitely working to prevent that, and this is part of that funding.
Thank you.
Thank you.
Question, Janet?
You asked my question.
Okay. Not seeing any, I've called the question. All in favor, aye?
Aye.
Any opposed? All right, motion passes. Number 3D, now we are on to 3D. Request to accept grant funds from New York State Department of Health AIDS Institute for the Disease Intervention Services for the period 1/1/2022 through 12/31/2026 in the amount of $1,125,000 and to appropriate into the operating budget first-year funds in the amount of $225,000 for the period of 1/1/2022 through 12/31/2022. This is legislative request 093. Can I have a motion?
So moved.
Mr. Chairman, I'd also like to add it.
Okay. Okay, Doctor.
Thank you, Mr. Chairman. So our sexually transmitted infection and disease intervention unit that's funded by the New York State Department of Health AIDS Institute. The sexually transmitted infection unit utilizes the funds from the New York State Department of Health Disease Intervention Services funding to cover salary and fringe for one full-time public health investigator and one full-time support staff. In 2021, Orange County was listed as one of the top 5 counties in New York State outside of New York City with increasing diagnosis of early syphilis and congenital syphilis. Year to date, Orange County Department of Health has investigated 4 cases of syphilis during pregnancy, which were all diagnosed within a 7-week time frame and exceeds the total amount of syphilis in pregnancy investigated in 2021. We're actually currently investigating another case, unfortunately. It's an issue that's another one of our health alerts that I will allude to during the update that we have sent out to providers. We've hosted a number of grand rounds with the medical providers and especially in lieu of the novice strain of syphilis that we've seen. It's definitely a concern.
Okay, so you can go into that a little bit. Any questions? Not hearing any, we'll call the question. All in favor, aye?
Aye.
Any opposed? Motion carries unanimous. Okay, Doctor, if you want to go into your monthly update now, that would be great.
Thank you very much, Mr. Chairman. As far as the general overview, wastewater COVID analysis project at 6 different wastewater treatment plants in Orange County continues. There was a meeting held by the New York State Department of Health wastewater program specialists on May 5th. According to the New York State Department of Health, Orange County leads the state with the most comprehensive monitoring program. Thank you.
Yeah,
We are
that's great.
collecting at all 6 sites. We started our pilot very early on in Newburgh, and then after that, shortly thereafter, we just piloted the entire project all across the county. It's really helped us, especially pre-Omicron, with gauging where we are with viral burden across the county and issue localized health alerts to our congregate settings, a lot of our facilities that are susceptible, vulnerable, nursing homes, schools, other settings. So it's really helped with honing in on where we're seeing the increased transmission and allowing municipalities to issue those alerts locally and take further protective measures.
Are you noticing a spike now? Is it?
That's a great question. So that's where I'm segueing. We're seeing very small incremental spikes. They're not sustained for long as we've seen during Omicron. That's why we haven't issued the health alert. Now, the governor did convene a call on Friday to really alert health officials and the county executives across the state of the potentially anticipated spike in the fall. So that's really done to gauge where the stockpiling is for test kits and masks and just preparedness activities. But as we're gauging hospitalization indicators, as we're gauging where we are with wastewater surveillance, we're really kind of teetering that line with not issuing public health alerts early on. We're really waiting for a sustained transmission over time. So we are looking at that. We're still sampling at regular increments twice a week, all 6 stations. We just haven't seen that sustained increase to really precipitate and trigger that public health alert just as yet. So we're kind of keeping our finger on the pulse. So the department is holding COVID vaccinations by appointment only in Newburgh and Middletown offices. Now we are still hosting a number of point of dispensing drills around the county, but those are more targeted either with larger employers or congregate settings and facilities such as schools, nursing homes. And as they're requesting that we work with them, we're doing that also. Additionally, we're working with school districts. The nursing division continues to provide booster vaccinations to the homebound residents when needed. As I've mentioned, the public health alert number 4 was issued on May 6th for atypical present. I'm sorry.
I just had a question about the homebound individuals.
Yes.
Are you still only offering, the J&J homebound individuals?
No, we're offering Moderna vaccine as well.
When did that change?
That changed when Johnson & Johnson new recommendations came out that they should be receiving other vaccinations.
In the last few weeks or
A few months ago.
months?
Yes, it should be on the website. There was an update on the website.
Thank you.
Absolutely. Public Health Alert 4 was issued May 6th as far as atypical presentation of syphilis coupled with continued increase in reported cases in Orange County. We've held grand rounds with physicians at local hospitals on the subject. It pretty much describes, I think we've attached the alert. It was really gauged toward physicians, so they're keeping syphilis on the list of differential diagnoses because of the increase.
Legislator,
Just before you go ahead, I want to go back to the COVID question.
Yes.
How would you advise the general public to hear what you're saying? What you have to go to the CDC tracker and they list oranges, Orange County as an orange high infection. It almost seems inconsistent.
Yes, so as far as the
How
high,
do you use that?
yes, absolutely. So the rate itself went up. We are seeing an increase in cases. We're over 2,000 cases and we have doubled on the daily cases. We've seen upwards of 200 cases daily. As far as hospitalizations, we're not seeing the hospitalizations. We're not seeing the mortality follow through just as yet. And we don't have a persistent increase. So during Omicron, when you're looking at the wastewater surveillance, the viral burden was not only high, the incremental increase was very persistent, where we saw a very steep increase over time and we were able to issue that public health alert. Unfortunately, the CDC has quite literally changed the status from low to substantial to high on Friday at 1 o'clock. We were still trending as substantial, meaning medium kind of on Friday at 2 o'clock. And literally Friday, actually 1 o'clock. Friday, 1 o'clock, it changed as far as substantial rate of transmission. Again, it's highly dependent on data that they are receiving prior to, and it's in comparison to last week. So that rate of transmission was as compared to last week. That's why we're really gauging it more longer term, because if we're issuing an alert, it's an alert to say that future tense, there's a sustained risk of transmission. We're just not seeing it currently this week, this month. Not to say that in the fall it will be a drastically different case scenario. That's why I would urge the public to really either upload our free app where we have those push alerts and notifications localized, or to look at the public health alerts, because those are really geared towards municipalities where we're seeing that viral burden and the sustained transmission. Goshen went up incrementally 1 week, maybe 4 weeks ago, where it was a very substantial increase, but it was for such a short amount of time where we were not sure if it's travel related, if there was a convention in town, and that really contributed to that spike, but it was a very temporary spike. I hope that kind of explains it better because we have a better gauge on what's actually happening
I was
locally.
surprised because I'd seen the yellow and orange, and I think this morning or something I was looking at it, it was yellow for Orange County, and this morning it was orange.
Orange and
You
Friday,
said it
everything was
happened
red.
Friday.
And Friday, everything was red. So,
Yeah.
they're a little more sensitive with the data. Plus, again, with wastewater surveillance, it's quite a great indicator because it's an early means of detection and it's a means of early notification. When we're seeing that viral burden in wastewater, it's about a week to a week and a half prior to individuals even feeling symptomatic and presenting to the doctors. Plus, currently, not a lot of individuals are actually testing, and the CDC gauges that by the provider presentation. So just keep a lot of that also in mind as far as localized data. When we're basing it on viral burden, it's an indicator of what's to come in a week to a week and a half as far as symptomatology. So that's why it's a great early notification. So as far as public health alert number 5, and I will get back just briefly to COVID. Yes, I'm sorry.
Thank you, Mr. Smith. I have 2 questions. One I'll ask now, based on the current discussion on the COVID. If somebody home tests and they call the hotline, New York State Department of Health hotline, is that number recorded and reported back, or if they don't call the hotline and they just call their doctor to get the Paxlovid or the antiviral medication, is that number reported and is that part of our reporting process? I know ever since the home test came out, there's been.
It changed the
It changed the dynamic of what our positivity rate is because people are not necessarily going
Yes.
to the doctor or reporting it.
So the answer is no. Home tests are not at any point reported. So home saliva tests, any other means of testing other than PCR and provider rendered tests are not reported in the database. Only provider administered tests are reported as confirmed tests. I'll even go a step further, and actually that's kind of part and parcel of the COVID public health alert. We've drafted a public health alert for COVID, and we're just kind of waiting to see where the metrics are and wastewater surveillance will be. But we are even receiving anecdotal data of providers seeing patients and pretty much at this point treating it as a viral quote unquote infection and just providing treatment, which is problematic at a provider's office, especially if there's subsequent complications or presentation to the hospital. So that public health alert that has been drafted also notifies providers that when you do have a patient presenting in a clinical setting, to actually have that confirmatory test, especially prior to administering treatment. Specifically with COVID at this point, we're not treating it as just like influenza, just as yet. Maybe the protocols will change, the clinical protocols, as we're progressing along. Obviously, a lot of protocols have changed as we've changed with pandemic response. But the short answer to your question is no. Home tests are not reported at any given time with the statistics, and that's why the statistics that are reported as far as testing with CDC and with statewide parameters are highly skewed, while viral burden is an actual raw indicator, quite literally, of viral disease burden in any community.
Which I understand that, but we also have a lot of communities in Orange County that individual homeowners rely on their individual
Absolutely.
septic system.
Over 60%.
So we can't.
But typically it's an indicator because at least our most densely populated area, at least in Orange County, are fully covered as far as all of our six densely populated areas are a fantastic indicator of where we are in those areas as far as transmission rates. So it's a great gauge. It's definitely not a perfect system, and you're absolutely right. Over 60% is well water.
Yeah, that's why I was curious, because I mean, a lot of people are calling for their doctors for the Paxlovid and so on and so forth. And I myself had COVID again a couple weeks ago, and my whole family did, and we did the home test. I had called the hotline because I was sure, because it's been changing so much with what the quarantine requirements were. And then I called my doctor for the Paxlovid. And so I reported at 2 places, so I was wondering if any of those were ever recorded.
I mean, I wish the answer was different, but no, they're not. And that's why the data that's reported at some of the sources, and that's the other answer for the CDC versus local indicators. No.
Thank you, Mr. Chairman.
Absolutely. As far as public health alert 5, we have issued public health alert 5 on May 14th. As far as childhood immunization update, the most recent data analysis, as I mentioned previously, has Orange County listed at clearly a much lower vaccination rate than the rest of upstate New York, other than New York City. So we were at 37.39% of 2-year-old resident vaccination. And that includes obviously immunization by 2-year-olds, so that's for Tdap, polio, MMR, uptake of varicella, BCV. Yeah. So that's for 2-year-olds. We've issued that health alert to go out to all providers on childhood immunizations to really alert them of the global situation that's ongoing. UNICEF and the World Health Organization warned of quote unquote perfect storm conditions for measles outbreak affecting children and reported worldwide measles cases increasing by 79% in the first 2 months of 2022 compared to the same period in 2021. The World Health Organization and UNICEF warns conditions are ripe for serious outbreaks of vaccine-preventable illness, pandemic-related disruptions increasing inequalities and access to vaccines, and the diversion of resources from routine immunizations are leaving too many children without protection against measles and other vaccine-preventable diseases. The risk for large outbreaks has increased as communities relax social distancing practices and other preventative measures for COVID-19 implemented during the height of the pandemic. In addition, with millions of people being displaced due to conflicts and crisis, including in Ukraine, Ethiopia, Somalia, and Afghanistan, disruptions in routine immunizations risk of vaccine-preventable disease outbreak. As measles is very contagious, one of the most contagious diseases that we know of, cases tend to show up quickly when vaccination levels decline. The public health alert goes kind of further into the breakdown. In the interest of time, I will spare you of reading the full public health alert, but that did go out to providers with a lot of our contact information. And we did offer a lot of our Orange County Department of Health resources to providers, to schools, to ensure that not only are we addressing potential for either pods and points of dispensing and mass vaccination potential, if that's a necessity, but also offering help with reallocating vaccination to clinics, maybe helping with the clerical end of it, where if there are vaccinations, they're just not entered into the NICE system, where we're helping out with that. Obviously, information for especially new mothers to ensure that they're vaccinating more rapidly, and also getting community feedback to see if there are any other means of just addressing this information and what the best opportunities kind of are in working with the state DOH and working with our communities.
Very good.
Orange County Department of Health is holding a health summit. So we are continuing to conduct listening sessions to speak with residents about their health concerns and needs. These sessions have already been completed in Port Jervis, Middletown, and Blooming Grove. We are actually holding a session in the town of Chester Wednesday, May 18th from 6 to 8. Please, if you see these sessions, I know we're competing against extremely nice weather outside, especially during the hours where everyone is taking advantage of that after work. But if you can, it's really helping us in 2 ways. We have a mandatory community health assessment that we conduct with all of our hospitals. This really engages the community and ensures that we have that feedback of what the priorities are, health priorities, as they're identified by our community. We're also seeing issues that we can resolve. It's a fantastic opportunity post-COVID to re-engage our community and to really describe the full scope of services provided by the local health departments, because I think the understanding post-COVID-19 is that COVID-19 is sort of the breadth of what we do. When it's just the tip of the iceberg, we monitor over 60 communicable diseases. We have a number of programs for early childhood services, medical examiner's office, environmental health division. So we really both are educating the community on all of the services that we offer, and also are kind of gauging that feedback. So that will culminate in our health summit on June 28th. That will be at the Rowley Center on SUNY Orange campus. We are asking attendees to vote. We already have over 100 people associated with organizations and healthcare providers that will be in attendance, but we're very much looking forward to that because it's a phenomenal opportunity post-COVID to really re-engage our community and to describe the fundamental function of the health department, which is not only to prevent over 60 communicable diseases and COVID, but also to ensure safe water, safe food. and among other safe environments, other programming. So that's really where we are. Environmental health. On May 11th, this was very interesting actually, because on May 11th, the division notified residents in the West Town area of a cat that tested positive for rabies. And we're getting back to the fundamental function. We had a resident that was scratched and bitten by a cat. That resident shot the cat and brought that cat in for testing. The cat tested positive for rabies. As we know, rabies is 100% fatal if contracted, and the treatment has to be rendered within 72 hours. So that gives a very short window of notification. So kudos to our staff at the Environmental Health Department with contacting that resident. That resident was able to seek, it took actually about an hour to get to that resident. So thankfully we reached the resident in time, and they were able to obtain post-exposure prophylaxis, and all went well. So it's a happy ending to that story, despite the obviously unfortunate incident with the cat. But it just goes to show you the versatility of what the health department does on a day-to-day. And that's, again, just one example, but it's a great positive example of how we can kind of really work with our community. Epidemiology and public health planning divisions. The epidemiology director will be presenting at the NACHO annual conference in July in conjunction with the New York State Department of Health and Cornell University about the establishment of public health fellowship program. Those are going back to the fellows that thankfully the legislation, thank you, approved. And the fellows are currently assisting with COVID activities, including data management analysis, a lot of communication. And I do want to remind that we do have a Facebook page where we've updated our website. We also have a free app that's available on all phone devices with push notification abilities, a lot of our clinic schedules, kind of an all-in-one free app. And the community health assessment that I mentioned, preparation, health education data management analysis, the data and health education for the sexually transmitted infections division, and department-wide social media and communications. I'm sorry, it was.
Legislative.
Thank you, Mr. Chairman. Thank you, Commissioner. My question was, have we already filled all of the positions, fellows for that?
Not all, but I believe we currently have 9 with 1 more coming on board at the end of July. So it's a slow but
9
steady.
open?
9 that we've currently filled
Filled.
with 1 more coming on
Gotcha.
board, and I believe a total of 19. If I'm
Yeah,
not mistaken.
That's in the commissioner's report that there was 1 left.
Yes, 1 left. No, actually 1 coming on board in July.
One
So,
coming
so
in.
we have quite a few more left, but
Yeah.
we're still
Oh,
waiting.
none currently, with 1 more coming on board in July.
July.
That's why I want to know the total number. Still left.
Yes, we have about 10 more
Yeah, that
positions
sounds-
that we're
that sounds
looking at.
I think I read that.
Yeah.
Yes. So that's essentially pretty much where we are, in a nutshell. Just to summarize, quite a bit happening, definitely with listening sessions. We need all the help we can get because the weather's very, very nice. So,
Legislative account?
Yes, I have one question. I'd asked this of the department, Marcy Miller. But WIC is under you, but I know it's contracted out. As she's going to send us an email for what she received to, people not watering down the formula, so on and so forth, careful switching over to milk-based products or soy products. Do we have anything that you're putting out on the county app and county website? And what are we doing? Do we have any resources to help people who cannot get formula connect with formula?
yes, so currently the WIC program, because it was severely underfunded, is under the federally qualified health center. So we
Right.
don't have it under the health department. However, with that said, the New York State Department of Health just issued an alert yesterday as far as a link exactly with those resources. So we will be issuing a health alert, just as a broader health alert that will be on the website, then it will be on the app to direct people to actually be able to utilize those resources. So the answer is yes.
Thank you.
Commissioner, I have another question too.
Yes.
I asked you, I think it was either two months ago or so, about the bird flu. Is there any progression with that? Anything that the county residents need to know? Has an alert or advisory put out on that?
Yes, so we did issue an alert and advisory just in case for all our farmers and all our
Yeah.
veterinarian groups and so on and so forth. I did speak with Cornell Cooperative Extension as well, so they're able to pass that on, and they're keeping very close tabs on that as well as far as alerts from the Department of Agriculture. So far, no confirmed cases, especially no transmission obviously in humans, but as far as even bird flocks, they are keeping really close communication with the farm owners. To make sure that they are kind of abreast of anything that happens, and I know the veterinarians,
And no transmission to humans, even if they
in Orange
inadvertently
County.
touch a dead bird.
So that's in Orange County because there has been one case thus far of a confirmed transmission nationwide in the US, but
Okay.
nothing in Orange County as of yet, no.
Okay, would you be able to just send that alert out again to Doreen?
Yes, I will absolutely, I think I forwarded it, but yes, we will forward that
I
again,
think pretty much all of
absolutely.
us have farmers in our area just to make sure that.
Absolutely, and we have sent that over to Cornell also so they can disseminate that, but we can send that to the.
Terrific. Any other questions, concerns?
Thank you for.
Thank you very much. Thank you.
Thank you, Commissioner.
Thank you. Stay well.
Thank you,
Have a good
Chris.
Thanks for letting me sit back here.
Sure. All right, not seeing anything else. Oh, we do have something else. Turn the page, one more thing. Item number 4, resolution of the Orange County Legislature designating June 26, 2022 through July 2nd, 2022 as Helen Keller Deaf Blind Awareness Week. Can I have a motion, please?
So moved to adopt.
Any questions or comments? Not hearing any. Call the question. All in favor, aye?
Aye.
Aye. Opposed? Unanimous. With that, I'll take a motion to adjourn.
So moved to adopt.
All in favor of adjourning?
Aye.
Motion, aye.
Aye, 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 aye.